right. Good afternoon and welcome to United TV. Today is our Bariatric Friday day, so Dr. Irgau is joining me. We are going to cover our topic 2 in the cycle, and we are going to cover what to expect after bariatric surgery. Now, yes, we have covered this so many different times, but the issue is every time we cover these, we may be repeating some of the same issues, but from a different perspective, but also we may have some new points. So we are going to have Dr. Irgau to help us with this process today. And Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's wonderful to be back for another Bariatric Friday session. I have to tell you that your previous session with the chairman of CEO of Oracle Health was fantastic. It was excellent. I myself learned a lot. I did not realize that, as organizations, they pay attention to things like provider burnout, which is a real issue. And they want to provide solutions, right, from a tech point of view, which would be extremely good. So thank you for that. That was very well done.
And the feedback is always important. And, in that session, one of the things was what's important. Are we able to do certain things easier or easily? So, and one of the examples that I was giving, like being ready for these events.
Yeah. Yes, absolutely.
What types of tools I have, what types of access I have. Do I pay X, Y, Z? And can I do it? Can I not do it? And can I do something that's going to take 10 hours in the old way? And then can I do that in 1 hour? Yeah. So 10 hours, if that was taking that much for this YouTube session, Dr. Irgau, we probably wouldn't be here. Because
no question.
Our main business, our full-time job is not this. Yep. But if I'm able to do this for 1 to 2 hours a week and still able to do what we are doing, so then that is kind of the key for this whole thing. And I'm hoping that with the EHR, with the Oracle Health, it's going to actually provide us what we are looking for. There are a lot of things that providers, yourself, other providers who are going spending way too much time for something that can take 2 minutes.
Yes, absolutely.
So,
absolutely.
And I think seeing that approach and also seeing the actual work, that makes a huge difference. And speaking of tools, this is why we are doing this. So bariatric surgery is one of the most effective tools, and similar analogy that we can use with what's like ChatGPT can do versus just a simple Google search. I need information in a meaningful way. Fast is available. So this is why we are discussing the bariatric surgery as being the #1 option for those who are fighting morbid obesity. And that's why we are here today. So from the the overall outcome, if we can kind of summarize what patients are expecting, what we are expecting to see after the bariatric surgery. Now, keep in mind that we cover each topics in a different session, its own session. So just overall, if you can kind of give us that brief summary.
Absolutely. So essentially, after bariatric surgery, the most visible change we see is people's life changes in a beneficial way, completely. Their sense of well-being, their ability to independently move around and do tasks that were difficult before, their self-esteem, their overall health improves. This is what we see in bariatric patients. And I have to tell you, one of the reasons bariatric surgery is so appealing to surgeons like myself who practice it on a daily basis is that satisfaction of meeting the patients after the surgery, right? They've recovered well from their surgery. They're losing weight, particularly in the early weeks and months after bariatric surgery. They have the fastest rate of weight loss. So within weeks, they find themselves shedding 40, 50, 60 pounds, right? And with that, there is a sense of liberation because the change is so fast and so quick obviously they notice it. They notice it immediately. Like their weight, the high weight was just a few weeks before, and now they have a different weight, which changes the way they look, the way they feel, the amount of energy they have. And then beside that, there is the improvement, objective improvement in many health conditions, right? They find themselves now taking less and less medications for problems that they struggled with, when before obesity was addressed with bariatric surgery.
So now, if we can talk about the increased energy levels.
Yeah, absolutely.
So are we expecting this from every patient? Is it changing from one to the other? What do we mean by increased energy levels?
Well, when you speak with a patient who's struggling with severe obesity, and I'm talking about a patient who has an extra 100, 150, 200 pounds of weight over their normal weight, right? So a patient who's, for instance, 5'5", and their normal weight would be around 150, 160 pounds, and yet they are at 280. They may be at 300, sometimes 320. When they are waking up every day with that weight, they don't have energy. It's no surprise for a number of reasons. First of all, physically carrying that extra 100 pounds, extra 120 pounds, and trying to do things that people take for granted, small things, is very, very hard. It may be as simple as leaning down to pick up something that fell on the ground, as simple as putting your socks back in. That takes tremendous energy. There's a lot of shortness of breath with that. Not to mention the fact that their sleep is very often not restful, right, because of sleep apnea. So with all that added, even before the day has begun, they don't have energy, and they will tell you that. It's really a miserable life. And then suddenly you are liberated from that much weight, right? You have an ability to move around. You're sleeping better. Of course, you have tons more energy, and you feel it. Of course, immediately after surgery, in the first couple of weeks or so, there is going to be the surgery effect, anesthesia effect. So they may not feel as much energy immediately, just because there is recovery from surgery. But then 3-4 weeks afterwards, they're fully recovered from the surgery, and they can see the amount of energy they have. So this is actually an energy that drives their daily activity. They feel it. They know it, that a lot has changed, and they want to do more.
Thank you for that, Dr. Irgau. So just wanted to check something with the technical side, because I see your side is on mute, so I'm just double checking whether or not they can hear you okay. I'm assuming that they can, because we did the sound check. So I'm going to talk about one of our patients from this morning. The patient was 517 pounds. When our nurses presented this patient, the way that they actually brought the patient up as our patient has mobility issues. So I asked our nurse, I said, "What's your weight?" Well, she gave me the numbers. So whatever 517 divided by 4 is the number. So I said, well, she is 4 times your size.
Mm-hmm. Mm-hmm. Mm-hmm.
How do you not expect him to have mobility issues, right?
Absolutely.
So that's kind of like one of the main challenges we always have with people. Like, oh, are you just cutting people's stomach? No, we are helping someone who's at 500, 400, 375, 350, whatever their height situation also is.
Yep.
So this is bringing the mobility issues. This is
Yep.
bringing the energy issues. When as you are carrying more and more and more, your body actually is doing more work. So
Totally.
just like if I'm holding this glass for 5 minutes just in this position, this is going to get 5 times heavier at least, and I won't be able to do it anymore, right? So, and from that point, that's important for a patient to know how this is going to actually help them for the future with their overall health. Now, If you were to look into this from self-esteem standpoint, we want to focus on the great results of bariatric surgery and self-esteem, mental health issues. They're kind of like going hands in hand, and the morbid obesity is in the center of these issues in many cases. Can you give us some expectations for those patients, what they would be expecting?
Absolutely, absolutely. There are a number of reasons why patients who struggle with obesity also have depression very often, right? And the reason for that is because the obesity itself is obviously physically limiting them, right? Limiting what they could do, the things that I want to enjoy, whether it's by themselves, with their families, right? Simple things like you're a parent, right? And your kids want to go on a ride, right? On one of these rides, maybe they want to go to Disney, right? You take them there, you want to do rides, but you cannot fit in. You cannot be with them, right? That is a limitation that really mortifies people, right? And then on top of that, you've got the stigma of obesity, right? Because our society, instead of extending a hand and saying to people, how can I help you, is a judging society, particularly when it comes to obesity, right? So people feel that on a daily basis. Once they lose the weight, of course, they are liberated from that. That's why their self-esteem, their feeling of happiness is a lot higher after they've lost weight. And that happens very, very quickly after bariatric surgery. As I said, the vast majority of the weight loss occurs actually very shortly after bariatric surgery. So within the first few months, people will have lost maybe 60, 70% of the weight they're going to lose totally, through the process. So that is what I'm talking about when I say people feel really they feel so much better about themselves, and they project well, and they don't feel as guilty or as judged when they are walking around or interacting with others once they don't have the weight issue.
That's, even at a different level, losing a little bit of weight, if you feel like you need to, and then being able to see that, it gives you a lot of confidence.
Absolutely, absolutely.
So we have discussed the longer life expectancy, and this is not just some subjective way of looking at it, but there are studies that shows us obesity is linked to life-threatening conditions. And with this very powerful tool that we are talking about, the bariatric surgery can help to move that barrier and help those patients to have a longer life expectancy. So when we discuss life expectancy, just elaborate that, what we expect with these individuals.
So essentially, what happens, Kemal, is that the complications of obesity include also illnesses that are really the top causes of mortality in our society, in our country. And I'm talking about cardiovascular disease, which includes things like heart disease and strokes. I'm talking about high blood pressure. I'm talking about metabolic illnesses like diabetes. I'm talking about conditions like sleep apnea. All those contribute to the mortality, to the highest causes of mortality in our country, in our society, right? And they happen to be very closely related to obesity. And once you address obesity with bariatric surgery, you're actually reducing the presence of these conditions in that person. High blood pressure is reduced by 70%. Cardiovascular disease is reduced by about 80%. Things like type 2 diabetes reduced by 60, 70, 80%. Sleep apnea reduction can reach 95%, right? With that reduction, you're also taking away the risk of dying. In fact, people have looked into it and they've calculated that the 5-year risk of dying after bariatric surgery is reduced by almost 90% if you've had bariatric surgery. In other words, if you take a person who's had bariatric surgery and then another person with similar excessive weight, extreme obesity, who has not had bariatric surgery, and if you follow them for 5 years, the person who's had bariatric surgery has reduced their risk for mortality by 90%. It's tremendous. You are essentially adding years to that person's life simply by doing bariatric surgery. Now, if you ask me, is there any other medical intervention, single medical intervention, that can result in that amount of reduction of mortality, in that extension of the life expectancy? I would tell you there is none. Bariatric surgery is unique in that sense because it is taking care of a core problem that is causing many of the reasons of why people die in our country: cardiovascular disease, high blood pressure, type 2 diabetes. And you're addressing all this permanently. You're not just giving medications to control these conditions, right? You're addressing them permanently because the driving factor of all these diseases is very often obesity. So absolutely, reduction of mortality, extension of life expectancy are some of the extremely important benefits of bariatric surgery.
So one of the other things that we see as a benefit is a better relationship with food. So, last week when I was in the diabetes session with Caroline and Donna, we were talking about eating out and, what patients can and cannot do and how they should prep. And one of the issues that we have is the food and celebration. And celebration means eat more, so drink more. And that's something that is kind of like hard-coded in our DNA. But we see changes in terms of individuals' relationship with food after bariatric surgery. Can you actually help us to better understand what you see from your side?
Absolutely, absolutely. So one of the greatest challenges for people who struggle with obesity, Kemal, is control of hunger, right? They are constantly hungry, and they will tell you that, right? And hunger is something that you can control for a while. You can exert a lot of willpower and hold on to it. But when it occurs day after day, then you're defeated easily. And that's why over 95% of people who lose weight by doing diets regain their weight as well, because it's very difficult to control hunger. One thing that happens after bariatric surgery is actually, Kemal, is reduction in the level of hunger and in the frequency of hunger. And that doesn't happen just because the stomach has been made smaller. It happens primarily because the procedure itself interferes with many of the mechanisms that encourage hunger in our body. So very often, patients will tell us that they don't feel hungry, that they have to remind themselves to eat. Otherwise, they would have gone the whole day without eating, just because hunger is not there, particularly early after surgery. Right? So the struggle that people have with eating is not just a struggle because they like to eat. It's also a drive that they have biologically, which drives them to eat, right? So you have to imagine, that a person with obesity has all these calories inside them because they have so much fat, and their body refuses to use that calorie for energy purposes. It locks that calorie inside the cells, and there's the people, there is no calorie, you have to go and get some food. So it's almost like being a big tanker of oil, of gas, right? These big tankers that carry gas from from the depot to the station, right? If you are in the highway and you run out of gas, you stop, right? You cannot go any further, although you have all this gas, all this oil on top of the tank, right? But you cannot access it. It's the same thing for a person who suffers from obesity. They have all this excess fat that could be utilized for energy, and yet it's locked up, and they feel hungry, and they have to constantly go after food. Well, that changes after bariatric surgery. Now their body is able to have a key to unlock those energy sources that they have in their body in the form of fat, and utilize that fat for their energy. And therefore, they don't feel hungry. They don't feel compelled to look for food. So that's why they are in control now over the food, as opposed to before, where they didn't have control because they were hungry. And you're taking away that hunger.
And between the two major procedures that we do with the bypass, there isn't much room to eat more. With the sleeve, the part that makes us hungry and then telling our brain, hey, I'm hungry, that part is removed.
Yes.
Right? So this is that simple. So like when those communication stops, you know that you're not hungry because you are not hungry. Your brain is telling you that you are hungry. And brain is not originating that, it's getting it from the stomach. And then there are, our cells that's saying that, hey, I think I should be hungry, and then giving the false signal. So then, and then all of a sudden we start eating. It's just like, this, I think when we say better relationship with food, I just want to share something that just, and I'm not trying to make too much out of these things as I'm sharing these. One of the reasons that I'm sharing is because I want people to understand that we also go through these, how can I have a better relationship without penalizing or being punitive with myself? So yesterday we had the ACO meeting.
Mm-hmm.
So as I, usually if we don't have like a late dinner meetings, I eat a home cooked meal. And but then yesterday, because we were going to be here with a couple of the individuals who are going to be here later, so they wanted to have some food. So around like 5-ish. So normally I would be eating around like 7:30.
Mm-hmm.
And, I wanted to participate because I wanted to just say no, because I also wanted to, do something different.
Mm-hmm.
But, and I know that I had meal at home. So what I had to do was, well, I ate half of what I had here. That was right before the meeting, in case you were wondering why I was burping during the meeting. It's because I just ate. Normally, as you know, I don't eat before the meetings.
Sure.
But because this was a Zoom, so it didn't matter. So, but then I was able to just save the food for later at home, and didn't finish the entire plates here.
Mm-hmm.
And still didn't have any guilt feelings because I didn't overeat. There was part of it was kind of socialization with the team here. So, I mean, if I say no, then I'm kind of isolating myself. But hey, it's okay. We are not doing it every day, so let's just do it. And then you can always, like, if I ate here and then go home and I ate that, and then next thing is, then I'm gonna see you for a consult. So that's this relationship is now. I'm able to make these decisions perhaps easier than someone with much higher BMI.
Yes.
But still, we have to kind of see, like, do I want to have ice cream every day? Do I want to have dessert? And do I want to have, this or that? I mean, it's just every day, anyone who's in perfect shape, that person probably spends more time and effort to stay fit. So, that's kind of given. So that's, but what we are able to do with the program and after the surgery is take you to that same point where you are not in disadvantage of, hey, my body is telling me something else. So that's what it is. So I think it's important for people to also know that.
Yeah.
Now you mentioned all the different illnesses comes with morbid obesity, and we are going to actually discuss those in details in the resolutions of comorbidities after bariatric surgery. I believe it may be either next or the following week. So, but the percentages of resolutions on those, just because I haven't seen anyone who has morbid obesity but didn't have hypertension or didn't have diabetes or didn't have some other heart disease, psychological issues, and seeing that sleep apnea, that type of resolution is just by itself. That should be enough, but we still want to explain, because this is also lifestyle changes. This is also like, our behaviors, our habits, sometimes we kind of underestimate those. like I was talking to my mom. So today, this is the second time I'm talking to her, talking about her in a live session. But because she used to be so tired before the surgery, that was her routine.
Yeah.
Oh, I'm tired, and then, hey, after the surgery, they took care of three important veins and just replaced them with brand new ones. So she almost had a new engine, kind of. So the block is over. So
Yep.
she shouldn't feel that way, but she's trained by herself with
Right.
what she was doing before with the habits. She thinks that she's tired. And I keep telling her, no, you're not tired. And she doesn't look tired. So if you look at her pictures from before and after, it's a different person. So she looks much better, but she's trying to use excuses not to walk, not to do this. I'm like, no. Like this is like, it's a training. So in her case, that's more like a mental support that we are going to try to change this behavior. But in the case of morbid obesity, removing that barrier, like the actual the tangible barrier is the most important thing. And then there are still some psychological stuff that's going to follow.
Yep.
But I think seeing these changes is just amazing. And also patients to hopefully hear us, what we are discussing and why they are having certain things that probably is helpful for them.
Absolutely.
So we are going to be back with the other topics, and we are going to go into the details. Dr. Anything you would like to add before we close today?
So, I just would like to emphasize the issue here that obesity is not something that is a self-inflicted condition that can be resolved just by willpower. It is very complicated, very, very complicated. That's why people struggle so much, right? And it's complicated because it's driven by a biology that is so intrinsic to how our body works. And bariatric surgery tackles that. It changes the metabolic mechanisms that are geared towards us gaining weight all the time, right? And it is that change that transforms people's life as well. Right now, they have a tool, they have a way for them to be in charge of how they eat and how they live, essentially. And that, for me as a bariatric surgeon, that is one of the most satisfying things about my job, is to see the transition of patients before surgery and then after surgery, to see how much they have gained in terms of self-confidence, self-esteem, but also overall health.
Well, as always, Dr. Irgau, thank you for sharing your expertise and helping us to better understand the life-changing benefits of bariatric surgery. For those who are watching us, take advantage of these sessions. You may be a patient who's going through the surgery, you already had the surgery, maybe you're not there, but just want to manage the weight loss. So we are providing all these in so many different, from so many different perspectives every week, almost every week live. So, and we're hoping that we can touch those people's lives and make changes in a positive way. And that's why we are here every week. So we'll see you next week. And until next time, take care and stay healthy.
Thank you.